Welcome to the Attention Deficit Disorder Expert Podcast Series by Attitude Magazine.
Hello, everyone, and welcome to Attitude Magazine's ADHD Experts broadcast. We are pleased to have Dr. Thomas Brown here to talk about ADHD and autism in smart kids and adults. Before we get started, let me note a couple of housekeeping items. Those of you tuned into the live webinar may download the slides now by clicking on the Event Resources section of your webinar screen. And if you are interested in the Certificate of Attendance option, look for instructions in the email you'll receive around an hour after the live broadcast. For those of you listening in replay or podcast mode, you can visit attitudemag.com and search Podcast 356 to access the slides, the webinar replay, and the Certificate of Attendance option. And we'd like to just say, if you support the work we're doing here at Attitude to strengthen the ADHD community, we encourage you to visit attitudemag.com/subscribe and sign up for Attitude Magazine for your family or to share with a teacher or a loved one who could benefit from greater understanding of ADHD. And today's sponsor of the webinar is Landmark College online dual enrollment program, preparing students for their college transition. Their unique approach to online dual enrollment courses is personalized and highly supported, enabling your student to develop and hone critical academic skills, explore their interests, and earn college credits during their junior and senior years of high school or during a gap year experience. Their model uses universal design and a guided scaffolding approach to executive function skill building. For more information, please visit them at www.landmark.edu/dual, DUAL, or email them at online@landmark.edu. Attitude wants to thank our sponsors for supporting our webinars. Sponsorship has no influence on speaker selection or webinar content. Now for today's topic. When very smart kids or adults chronically underperform in school, work, or social interactions, it is often assumed that they are bored, lazy, or uncaring. Parents, teachers, and employers of those who are obviously bright but floundering may not recognize two challenges that often co-occur: ADHD and autism, including signs formerly associated with Asperger syndrome. Asperger syndrome was removed from the DSM in 2013 in favor of the umbrella diagnosis of autism spectrum disorder, which many researchers and clinicians see as a mistake. In this webinar, Dr. Brown will describe his work with high IQ students and adults who did very well in their earlier school years, but who had increasing difficulty academically and socially as they navigated middle school, high school, college, and/or employment. Dr. Brown is a Yale-trained clinical psychologist who specializes in assessment and treatment of ADHD and related problems in children, adolescents, and adults. After serving on the clinical faculty of Yale Medical School for 25 years, he has relocated to Manhattan Beach, California, to open his new Brown Clinic for Attention and Related Disorders. He is also an adjunct clinical associate professor of psychiatry and behavioral sciences at the Keck School of Medicine of the University of Southern California. You can ask questions of Dr. Brown during his presentation, and we will try to get to as many of them as we can after he is finished. Now, without further ado, let's introduce Dr. Brown, and so happy you could be here today.
Thanks, Wayne. I'm delighted to be here. It's an honor to be with you. Let me begin by saying that I think that the topic announcement as the misdiagnosis is a good thing to put up because it calls attention to a diagnosis which is often not recognized. And part of the problem with that is that it's a missing diagnosis. You know, as Wayne mentioned in his comments, This diagnosis, which was put over 20 years ago into the diagnostic manual, the DSM-4, was removed in 2013 and just all lumped in together with all the other versions of autism spectrum. Now, that makes some sense in some ways, but on the other hand, it's a little difficult. It'd be sort of like if we had the DSM, and of all they've got 157 different diagnoses. And if we said, let's just put all the anxiety disorders together and just call them anxiety disorders, and we won't distinguish between separation anxiety and phobic anxiety and social anxiety and panic disorder and agoraphobia and generalized anxieties. I think that it was a mistake for them to pull that out. Because the fact is, it's important to be able to recognize the characteristics that go with these various diagnoses. And so I tend, in our clinic, we still use the term Asperger syndrome. And I've got a new book coming out talking about ADHD and Asperger syndrome, recognizing that officially it's still simply part of the autism spectrum. But I think there's some value in recognizing that it has its unique characteristics that it's a good idea to pay attention to. So in this presentation, I want to talk a little bit about the various different kinds of smarts, because we're talking about smart kids and adults. But keep in mind that there's not just one kind of smarts. I'm going to offer a few case examples from my new book, talk a little bit about them, and some are younger and some are older people. Fully adult. And then I'm going to talk a little bit about Asperger syndrome. You'll notice I've removed the apostrophe S because I'm not so concerned with the attribution to Hans Asperger, who was the first one to write about it. But I do think that the term is useful for us still, in spite of the DSMs having made the changes they did. And I'm interested in how that overlaps with ADHD. And then eventually I'll talk a little bit about treatment and what can we do to help people in this situation. Now, as to the various kinds of smarts, if you think about it, we often say, oh, he's so smart, she's so smart. But if you think about it, there are many different ways of being smart. This is something that's taken from Howard Gardner's book published years ago, where you talked about, there's language intelligence, oral and written communication. Then that's different from musical intelligence, and that's different from logical and math intelligence with a calculating and logical reasoning. And then there's scientific, technological intelligence, like the computer tech stuff. Visual and spatial, the kind of things that's involved in architecture, bodily kinesthetic. Like dance. And then the two that are most relevant to what we're talking about today are what he calls personal intelligence, being able to understand one's own feelings and oneself, and interpersonal intelligence, being able to understand where other people are coming from. And it's these two kinds of intelligence which tend to be a bigger problem for those people that used to be called officially Asperger syndrome. And now it's officially in the book as simply one aspect of the autism spectrum. However, I think there's still value, as I said, in recognizing this separately. These are just a couple of stereotypes that you see in the media. Jim Parsons on The Big Bang Theory, and Leonard Nimoy, the Vulcan science officer of the USS Enterprise. And those are caricatures. But they talk about some of the strengths and difficulties of people like that. And here are a few more well-known things. You might, if you watch Saturday Night Live, you might remember a couple of weeks ago, Elon Musk was hosting and introduced himself as what he thought was the first person with Asperger's to be hosting that show. Anthony Hopkins, the actor, young Greta Thunberg, who's done a lot for environmental activism, Jerry Seinfeld, the comedian, Jim Taylor, musician, Isaac Asimov, the science fiction writer, and Susan Boyle, the singer. These are just a few of people who have come out and said, look, I've got Asperger's. Now, the CDC estimates prevalence of the various disorders that they're keeping track of for us. And when you look at how they're doing it for the autism spectrum, those data, prevalence data, are based solely on kids 8 years old and do not differentiate between the various subtypes. But when you take a look at the breakout, there's a wide range of intelligence differences from one part of that spectrum to another. About 31% of the people diagnosed with autism on the autism spectrum have IQs below 70. About a quarter of them are in the low average range, 71 to 85. And look at this, where the arrow is. 44% have IQs 86 to 130 and above. And when we talk about Asperger syndrome, we're really talking about people who are within that range where, anything that's average, or sometimes they go way high. And the fact is that about 85% of the kids who are diagnosed with autism spectrum are recognized before they're 3 years old as having this difficulty. However, for those who have higher IQ, often it's not picked up and diagnosed until considerably later. And as a result, they tend to be a population of people who tend to be quite vulnerable. I'd like to introduce you to some patients that I've worked with of various ages, whom I've also described in more detail in a new book that's coming out this summer. Joshua, 11 years old, came in to see me with his parents, and he said, I'm in school to work ahead. I want to get to college faster, where I can be around others who are very smart like I am, and who will share my interest in music and in theoretical physics. I don't have many friends at this school. I'm lonely there. The other kids are not like me, but at least I'm not getting bullied like I was at my last school. I used to be pretty depressed and had thoughts of suicide. It's been better recently, but I do still worry. Think about the reference to the bullying. Those kids who have these difficulties with Asperger's, are very often mixed in with the general population of kids in the school. Some may have special education services, but most of them are in mainstream classes and in social interactions. And often they get recognized as really different in ways that other kids tend to make fun of. This is what Joshua said to me in the first conversation. He said, I'm a nerd who's in school just to work ahead. I get along a lot better with grown-ups and with older kids than with kids my age. I don't have any friends at school. I'm lonely there. I want to get into high school as fast as I can and then get into college where I'll be with other people who are smart like I am. When I get there, I want to major in theoretical physics and minor in law or business. He didn't know much of anything about theoretical physics. I've always had trouble focusing on anything for long. Think about ADD. And I've always had depression and some thoughts of suicide. I also have migraines. I'm germphobic. I wash my hands until they're red and raw. And I also fidget a lot. He's presenting all these symptoms to me in the first part of the first conversation. But 2 years prior to the time that he came with his parents to see me, when he was in third grade in a mainstream school, they did a neuropsych evaluation. And one of the things that the psychologist did in that, they sent me a copy of the report, was he gave them a sentence completion task. And when he presented that to Joshua, he said, other kids, and then finish the sentence for me, please. And Joshua's response was, other kids are mean to me. They annoy me. I can't understand why kids are so mean to me. My mother thinks I'm very nice and special. My father thinks I'm very nice and special. And then they asked him, well, what would you wish for if you could wish for things? He said, I would wish for everybody to be nicer to me, that I'll be able to fly and I'd be able to do anything. Now, I think what that reflects is the fact that this boy was growing up in a family where he was their only child. And the parents were very proud of him, and they kept talking with him about how bright he is and how smart he is, and didn't recognize some of the difficulties that he had. And as a result, he came across in a way that sort of turned off other kids They were always praising him as gifted and highly intelligent, much smarter than other kids. And when he would come home complaining that other kids were teasing him and hassling him, they said, oh, they're just jealous of you. When the fact is, Carol Dweck, a psychologist who was with me in graduate school at Yale, has done a lot of very good work on the issue of when kids are repeatedly praised for their intelligence, they're likely to have difficulties because they tend to give up too quickly if they get confronted with something that they can't master right away. And the fact is that it works much better if parents respond to the strengths of their kids by acknowledging their hard work and reminding them that it's not the grades that are most important, but how hard they're trying. That usually will enhance their learning and also allow them to stick with the issues that they need to be working on that don't come so easily to them. One of the struggles that many kids with I would call Asperger's syndrome is that they really struggle when they're with other kids, particularly if they have gotten the idea that they can do things that nobody else can do and that everybody else is beneath them. After we had done some work, I talked with the parents, and he was in a school where this was a very private school where each kid was in his own little cubicle and there was no social interaction. And they were lucky enough and worked hard to find a school placement for him where he was a great musician, and where he could be working with other kids who have particular gifts in the art. But it was a long van ride. So he got in the van the first day, and it was kind of crowded, and he went to squeeze into the back of the van. And this one Afro-American boy said to him, you're a little pudgy. Can you fit in back there? And impulsively, Joshua responds, well, at least I'm not black. And he said he realized immediately after those words came out of his mouth that was not the right thing to say. And nobody talked with him for the rest of that ride. But then we did work together in therapy to talk about how he was going to go back, because I saw him that very day. And so when he went back the next day, he said to this kid who had made that comment, sorry about what I said yesterday. I'm not really a racist. I was just really uptight about my first day of school. And fortunately, the other boy said, no problem. I remember how I felt my first day. We get used to it here. We roast each other once in a while, but we can still be friends. And I think it's important to look at this as an example of the difficulties that many of these kids who are very bright, who have Asperger's, their lack of interpersonal intelligence, and sometimes their lack of experience interacting with other kids their own age, leaves them handicapped, in their being able to do it. A little later on, soon after Joshua had been there for a few weeks, he was participating in class and was doing well, but he wasn't going to the lunchroom. He'd go eat his lunch by himself. And he said that, those kids, they're always gossiping and looking at Instagram together. This is about lunch. I can't understand much of what they're talking about. It's like that Calvin and Hobbes cartoon saying, we're both speaking English, but we're not speaking the same language. You see, a lot of what kids learn about how to get along with other kids does not come from parents. It comes rather from their interaction with other kids. And very often, kids in the group we're talking about have a lot of difficulty in being able to learn the idioms, the sort of ways of conversing with other kids. Because there's a lot, Judith Harris has written about the role of parents in helping to shape social skills, and emphasizes it's the peer interaction that really shape these things. And her research shows that. But one day after he had been there for a couple of weeks, Joshua came in and he said, the other kids there are not talented in every way. Each one is just talented in a particular way. They're just like normal kids. That was a very important insight for him, because he had this notion of himself as super above everybody else his age. And now, as he was having a chance to hang out more with other kids his own age who also were good at art, in various arts, he had a chance to see that they're kids. and that each one had their own strengths and their own difficulties. But let's look at another case. This is Bella, 13-year-old girl. And her mother brought her in. She'd been seen by another psychologist, or psychiatrist actually, 3 years before she came to see me. And the description written in the report was that she's a very bright and talented girl who suffers from significant difficulties with executive function and meets diagnostic criteria for ADHD. They tried her on a regimen of medication, which didn't prove helpful, and it wasn't adjusted, and they sort of gave up on that. And so her mother brought her into my office and was reporting that the kid had been increasingly moody and had a lot of episodes of anger. She was stressed out, lashing out at her mother, yelling, sulking, crying, restlessness on a daily basis, and started talking, "What's the point of living? I'm just going to kill myself." Although she never engaged in any kind of self-harm behaviors or violence, but she was very isolated. And the diagnosis that had been given to her just before she came to me was just generalized anxiety disorder. And they put her on some medicine for anxiety, which didn't do very much. But the thing that I was struck by is when she came into the office, she has a large stuffed animal with her. And she was very good about talking about the difficulties that she was having in school. And then she said, and next year, there's a high school. The juxtaposition of the things that were going on in terms of her situation at school and the tone and her whole clutching that animal, I think, was a clue to some of the struggle that she was going, because she was quite socially isolated. I asked her mom to get the teachers, each of her several teachers in middle school, to write a little bit of a note about it. And here's what I got. One teacher wrote, "Bella interacts with her classmates in classes. She focuses on things she finds interesting. At times, I find her writing in a notebook or reading. During class discussions, she may focus on what's being discussed, or she may just ask a question that's off topic. She seems to lack a filter in public settings. Her classmates have come to accept her quirky and somewhat offbeat personality." Another teacher said, "Bella's ability to grasp the subtleties and nuances of the French language is refreshing. Her patience and attention to detail goes way beyond her years, but at times she falls behind and loses interest in her work. She constantly has a book in front of her. Her interaction with other students seems quite limited, and the receptions of other students to her seems to be somewhat guarded. She has her own agenda, and she makes it apparent." One more teacher. "Bella chooses not to interact with the other kids. When Bella is put into groups, she moves her table away from the other students and reads her book. She doesn't participate in any one-to-one conversation or even in group conversations. She'll purposely call out sometimes in class, causing a distraction. Sometimes the purpose is to make students laugh, and other times they'll just elicit a different kind of reaction." The teachers were generally saying she doesn't interact much with other kids, but she's got a lot of academic strengths. At home, her mother said she was typically playing video games for 4 to 6 hours every night and had very little interaction with other kids. Although she was a pretty impressive kid in some ways. I did some testing on her, and I asked her to do it. One of the things I did was a test for her ability to do written expression. And so she had 10 minutes to write a short essay in which she was asked to say, "Tell me about your favorite game and give 3 reasons why you like it." Here's what she started with. "Picture a universe with infinite possibilities, only restrained by the bounds of your imagination, where there are no rules, no predetermined objectives aside from those you choose. That, my presumably skeptical friend, is Minecraft. With savannas dotted with bushes and acacias to plateaus that cut through the clouds, the diverse landscapes are a sight to behold." That's pretty sophisticated language for a 13-year-old. And it's an example of her strengths, but it also shows you something about how she's working in a way that doesn't leave much room for other interactions with other kids. And she needed some help with this. Before I gave any further response to the evaluation, she handed me a note. And this is what she said. Some reasons, not excuses, in parentheses, but reasons why I struggle in school. ADHD, even with the medication, I still have a tendency to doze off and get distracted and procrastinate. Can't help it. It's the way I've always been. Sometimes I get called on out of the blue to answer a question I didn't even hear. And there's a lot of work. I just get spooked and hide from it. But believe it or not, I legitimately care. I'm not stupid. I'm not unintelligent. Yes, I procrastinate, but this is not the work of a lazy adolescent. Pretty articulate for a kid her age. So this is another piece, and you can see the difficulties that she had to deal with. And with medication, she had been put on Vyvanse, which often is very helpful. And in her case, that didn't work out. We had to switch over to Adderall. I'll talk more a little bit about medications a little bit later. But let's look at somebody else now. This is Anthony. I saw him first when he was in high school. And his mom gave me a note. She said, in many ways, Anthony has always been an easy parent, an easy child to parent. He's very sweet and kind. He's not a demanding person. Other parents and teachers often rave about him, what a nice boy he is, and find him interesting. He always seems he could learn things easily, has an incredible memory, is great with trivia facts, wants to be an engineer. And even in this area he loved, in which he excels, his ability to get things done on time is a problem. His mother then went on, he has no organizational skills, and his homework's now a marathon, taking twice as long as his teachers say it would. Writing is excruciating, and he'll often say things to people that are just slightly inappropriate, that just don't fit. He misses nonverbal clues. So you get a picture here of the academic strengths, but some of the difficulties with social interaction that are typical for the population we're talking about. And when he came in, and this was after he had been, I'd seen him initially while he was in high school. We started some medicine. He was doing better, and he was followed by his pediatrician. And then a year and a half later, after he had graduated, he came back with his parents because he'd been away at college and it had not worked out well. You can see from what he said here, he said, I was doing pretty well since I came home from that out-of-state college I was going to. My grades in this local college are not perfect, but he now came back and was living at home. But they're pretty good. I was feeling proud that I had finally found a girlfriend and went out with her a couple of times, and suddenly she broke it off and didn't want to see me. I texted her and tried a bunch of times to see her, but she said no and then got a restraining order against me. And then I met her in the parking lot at school so I could ask her what happened. I had no idea that I'd get arrested and put in jail for that. You can see there the desperation that he felt to be able to have a girlfriend, and at the same time, his inability to understand, or as some of the workers in this field say, mind read, take the point of view of somebody else to see why it was that after the date and she was not interested, made it clear she wasn't interested in pursuing it, that all he could think about was that he had to get her to explain it and hopefully talk her out of it. And these social interactions can make a big difference in terms of the strengths or also the misery that many of these kids that I'm calling Asperger's have. And he needed quite a bit of help to eventually, he described when he was away at that school for a year and a half, he said he wanted to get to know other kids, but he felt so awkward and out of it in the social situations. He didn't get some of their jokes and didn't feel like he could join them in meals. He often was eating his meals alone and spent time alone in his room. It just felt so out of it and needed a lot of help to be able to learn how to organize study groups with a couple of other people. And he also had a lot of difficulty with OCD, where he had great difficulty in being, and that was a secret for him. For example, he had to walk up 2 steps at a time anytime he was going up a staircase. If he lost count while he was doing, he had to go down and try again. And that sort of thing had not come up earlier in his conversation. But let's take a look at another. Richard, when I graduated at the top of my class, in a very competitive college, by the way, and then got hired in a big law firm, I felt good. He'd already passed the bar, but they terminated me in less than a year for reasons that were never clear. And then I got a job in another law firm and got fired from there because I was late in completing a couple of projects and didn't communicate enough with my supervising partner. My girlfriend, with whom he was living, says, I'm smart and I work hard, but I have difficulty reading where other people are coming from. Now I'm looking for another job, but it's not going to be easy. This is a very bright guy who not only passed the bar exam, but was tutoring some people, earning some money by tutoring some people for the bar exam. But the problem was that socially, he was clueless in his interactions with other people that he was working with. And one of the things that happened was that he had a situation where he was wanting to get himself ingratiated with the lawyer that he was working with who had given him assignment. And he ended up doing a very thorough job on the assignment. But the lawyer had said, I have to meet with this client in 3 days. And so he gave him the date. And he was a half an hour late to getting to the meeting with his report, not realizing at all how that left the attorney, in a difficult situation. Another story that he presented was that there were several other clerks when he was working with one of the judges as part of his training, his clerkship. And he just gave them a cold shoulder. He wasn't particularly interested in them. And the secretary that they often chatted with, he wasn't paying any attention to her. Well, it turns out he found out eventually that there had been a call coming into the office that secretary got where somebody wanted to get a reference for him and was thinking about hiring him. And the secretary said, don't hire him. He's not good at getting along with other people. That was the result of his never having been able to make the connections with these people. And I think it illustrates the importance of people being able to learn how to get along in social interactions, that kind of intelligence, is really vital in terms of success in work, regardless of what kind of work you're doing, as well as in getting along with the people that are working with you. Okay, there are many different types of personalities. Not like anybody with Asperger's is always the same as everybody else. I've got some of them listed here. That some are just kind of shy and very dependent in clinic, and others come across as sort of arrogant know-it-alls, and some of them are very driven high achievers and are looking for intimacy at a distance. I had one girl who said that, yes, he had a boyfriend, but that he was living 3,000 miles away, and they were very rarely in touch with each other. It's not that all these people are exactly the same. And in fact, the milder forms of autism are more common. And often they're not picked up. For the higher IQ people on the autism spectrum, often they're not recognized and diagnosed with that autism, or I would say Asperger's, until their adolescence or adulthood, which means they're not getting any help. Simon Baron-Cohen, who's head of the Asperger's program at Cambridge University in the UK, has studied a lot of adults with Asperger's, and he said that some of the things you see about them is they tend to be loners. They often don't know how to interact with their peers. They much prefer talking with adults rather than playing with or talking with other kids. Often they're not invited to play at classmates' homes or birthday parties. They're not into pretend play. They stick to very factual, more scientific stuff, nonfiction reading. And they often have areas in which they really specialize and are quite knowledgeable, but often they don't get their schoolwork done. And as a result, they've got problems in terms of academics. So how many children with autism spectrum have ADHD? Well, if you're looking at community samples, the studies, depending on how they're defining it, are anywhere between 13 and 50%. But when you look at clinical samples, people who are identified as having an autism spectrum disorder, the prevalence of ADHD in that population is between 20% and up to 80%. And the better studies are on the higher end, not the lower end. Unfortunately, sometimes you end up, this is a study that was done at Harvard. They had 140 kids, the ages 6 to 17, who were brought into their specialty clinic for autism spectrum. And all of these kids had IQs of 85 or better. and had an autism spectrum diagnosis. They evaluated all of them for ADHD. And what they found was 76% of those with autism spectrum in that clinic group fully met ADHD diagnosis, and 41% of those who had autism spectrum and ADHD had received no diagnosis or previous treatment for their ADHD, which is a problem. Talk more about that later, but some basic facts about ADHD. We think about this not just as a behavior problem. Often it's not that big a behavior problem, but the impairments of executive functions of the brain. All of these are problems everybody has sometimes. Just people with ADD have a lot more trouble. It's inherited. 1 out of every 4 people with ADHD has a parent who's got it. But the thing that puzzles a lot of people is this bottom bullet. Everybody I've ever seen who has ADD, and that's a lot of people, has a few tasks or activities in which they have no trouble exercising executive functions that are quite problematic for them in most other situations. And because it then makes it look like that's a problem with willpower, when in fact it's not. It's that the brain of somebody with ADHD turns on and functions much better in its executive functions if whatever they're dealing with is something that really interests them, or they're afraid that if they don't take care of this, something very unpleasant is going to happen fast. This is a model that I've published and talked about quite a bit. I'm not going to take a lot of time to labor it. You can see it on my website, the details of it. But just as a reminder that the elements of executive function, you can write an equation that says ADHD equals developmentally impairment of executive function. And these executive functions include organizing and being able to prioritize and get started, being able to focus and then shift focus when you need to, being able to regulate alertness and keep up the effort to finish things and to do reasonably fast processing speed. DSM has nothing to say about managing emotions, but that's a big part of ADHD. Utilizing short-term working memory. Sometimes there are people with ADD, their memory is amazing for long-term stuff, but they can't remember what happened just a couple of minutes ago or what they just read. And then monitoring and self-regulating action. These are little separate compartments, but the fact is all these things are dynamic and they interact with each other. So what can you do about it? If we're talking about with somebody who has this Asperger syndrome and ADHD, one of the things that's most important is for the individual and the family and the teachers to have information about ADHD and also about Asperger's syndrome as they need it. Provide adequate scaffolding and personal support, particularly with new situations, which are especially difficult for these kids. And then intensive psychotherapy is not likely to be very helpful for many of them, but to learn to be able to use the teachable moments to help them understand why it is that sometimes they get into difficulties with other people where they just don't recognize what's happening. And then the importance of fine-tuned, and I'd emphasize fine-tuned medications to alleviate their ADHD symptoms and if needed for related problems. Because ADHD is fundamentally a chemical problem, and the most effective treatment is to change the chemistry with medication. For 8 out of 10 people who have ADHD, medications can be helpful if those medications are adjusted. But the amount that is needed, the dosing, doesn't go by how old you are, how much you weigh, or how severe the symptoms are. It's how sensitive is your body to it. This is a picture just describing what the medicines do. This is the sending side of one neuron. There's 100 billion neurons in everybody's brain. These are about 3/5 the diameter of a human hair. And then here's the opposing side. And what this cartoon is showing us is that the electric charge comes when a message is coming through the brain, and it has to release microdots of a chemical, most often dopamine, but sometimes others. That's what's involved in the medicines we use, and hit these receptors on the other side. And it hits enough of the receptors fast enough, the zip goes on, moves the message, and gets things done. But then you've got to also get it cleaned out. And these shapes here are the functions. The function is the reuptake. And they suck back up this chemical that's been released, because otherwise you're locked open. You're not going to be able to get anything else through. the importance of this in medication is important. But the other thing that's important is for people with autism spectrum, particularly with Asperger's, many of them have very sensitive body chemistry. That's what the SBC stands for. And so you want to start with small doses and then gradually taper it up to find that sweet spot between too little and too much. For the ADHD symptoms, usually we start with stimulants and possibly some guanfacine, which isn't so good for focus, but it does help to calm down some of the other things. Atomoxetine is our third line usually. It works well for some people when nothing else will work, but usually the stimulants work considerably better. But sometimes we also need to add other medicines for the excessive anxiety or OCD, mood problems, fluoxetine and sertraline being a couple widely used. And then for excessive hyperactivity and impulsivity and aggression, usually we use guanfacine first, often in combination with a stimulant. And then if necessary, we could use a very small dose of Abilify or risperidone, both of which are approved for this population. But I'd like to just mention to you the importance of monitoring the response. This diagram is one that I think is important. If a person's taking a medication for ADHD, and let's say it's kicking in here, it could be a half an hour to an hour and a half, depending on which version, and then it works for whatever length of time it's going to work, and then it comes down. If during this time, the person taking is feeling too wired, like they've had way too many cups of coffee, or too crabby, where every little thing is pissing them off way more than it would normally, or too serious, where they sort of lose their sparkle, their spontaneity. If that's happening during the time the medicine's in and then goes down when the medicine wears off, the dose is too high, or it's not the right medicine for them. However, if these things are not happening when the medicine's active, but they do start happening as the medicine is wearing off, that's a completely different problem. That's a rebound. And what it means is not that the dose is too high, because that you would have seen here. It means it's dropping too fast and you're crashing. And so usually you can fix it easily with a small dose of the same medicine that we're doing as the stimulant. So that kind of fine-tuning is critical for being able to get ADHD medicines to work for anybody. And about 70 to 90% of kids and adolescents and adults respond well, but the symptom improvement for some, it's huge how much it helps them. For others, substantial but not huge. Usually the adverse effects are not very significant. This is a statement by the people who did that study at Harvard that I mentioned to you a few minutes ago. And they're talking about the importance of recognizing ADHD in people with Asperger syndrome. And I'm quoting here, failure to recognize ADHD, especially in intellectually capable youth with autism spectrum disorder, can seriously undermine their educational and social functioning, worsening an already compromised social performance, and can predispose these kids to increased risk for disruptive behavior disorders, mood dysregulation, and substance disorders. This is a list of some resources. The one, this is my commercial here. This is a book that ADHD and Asperger Syndrome and Smart Kids and Adults, which will be released this summer. It's already available on Amazon. And then the earlier book on Outside the Box and Smart But Stuck. But John Robison's book on Look Me in the Eye is very important. Liz Laugeson's Science of Making Friends, and then Tony Atwood's Complete Guide to Asperger's Syndrome, all of which I would recommend. And then these are some of my other books, and this is the new one that's going to be coming out hopefully within the next couple of months. So let me stop at this point and see if Wayne has any questions that are ready for us.
Yes, we have loads of questions. That was excellent. Really an excellent presentation.
Thank you.
A lot of people want some practical information. What sort of treatment do you recommend for a 7-year-old with Asperger's to address improvement in social interaction?
Okay, one thing I'd want to do is to find out what's going on in terms of behavioral problems. Because if this particular kid happens to be acting in ways that are too restless or too aggressive or disruptive in school, that's going to get him in trouble on 2 or 3 different counts. And so I want to look and see, do we have ADHD symptoms that need to be treated with the usual medications, although starting low doses and then gradually tapering up? Is this somebody who's likely to need a little bit of additional medication if there's too much restlessness? And then to work with parents to try to help them to learn how to use the teachable moments. Stay in touch with the teachers and observe the child in interaction. Even these very young kids can learn a lot, but it needs to be taught in terms of very specific situations. When this kid did this and you did that, that's a problem. A better way of doing it would be this other alternative.
Mm-hmm. Several questions about how do we find therapists and psychologists and psychiatrists who understand these kids with both Asperger's and ADHD? Go ahead.
That's a good question, because the reality is most psychologists, most psychiatrists are not trained to deal with difficulties on the autism spectrum. And that's an area where your best bet is to talk with other people who have kids with similar needs and see what's available in the neighborhood, to look at information that's available on the CHAD list of resources or the Attitude Magazine's list of resources, and see which people are identified as offering these services, see who's published books on it, and try to get word, and then just ask the local pediatrician. Sometimes we'll be able to tell you, oh yeah, there's this psychologist or this psychiatrist who we had good luck with that kind of thing. But I don't want to make it sound as though it's easy, because it's not, because there are not a lot of people in those various helping professions who have this specialty.
Mm-hmm. Yeah, because a lot of people have brought up that, and sadly so, that the Asperger's was missed. The ADHD was diagnosed, the Asperger's was missed, and it sort of sent them on a path that wasn't the best for their child.
Exactly. Yeah, I think that's the risk. That often what gets picked up is what's most obvious and what more people are familiar with. And it's very important to try to, get in touch with with pediatrician or other parents who have some kids with similar concerns. And Autism Now has done a good job, and there's the Autism Parenting magazine, which has a lot of articles about this. And you can get information about this in your own magazine,
right?
In Attitude. And often that will lead you to people you can get in touch with who may be able to help, if not face-to-face, then possibly on Zoom.
Mm-hmm. Several people want to know the effect of ADHD medication, and I think you might have touched on this, on Asperger's.
Well, ADHD medicine can be very helpful with people who have Asperger's. However, what I've tried to emphasize is that many of them have very sensitive body chemistries.
Right.
And I've had many patients brought into my clinic where the parents will say, "Oh yeah, we tried," in the name of 3 or 4 or 5 different medicines often used for ADHD. And when I ask about the dose, I find that that the kid was started on a dose that was really too high for them, and they didn't back it down. They just jumped to a different medication. Mm-hmm. The fine tuning is very important, and so it's better to start with these kids. Many of them have very sensitive body chemistries, and you want to start with a minimal dose, but don't leave it there if it's not doing the job. And gradually titrate, just sort of take it up a little bit at a time, looking for that sweet spot between too little and too much. If you have too little, it doesn't do a damn thing. You might just as well be taking breath mints. But if you have too much, then you're going to get that jittery or real crabby or too serious. And those are things that can usually be adjusted by dosing and changing the time in which it's being done.
Mm-hmm. Some people are caught up in the terminology. Are Asperger's, high-functioning autism, and level 1 ASD the same?
Okay. Most people with Asperger's that I would call Asperger's are officially now diagnosed as autism spectrum disorder level 1. But the fact is that they I think that diagnosis should be back in the book. Mm-hmm. and it makes it a little bit easier to do it. I'm sorry, there were three things you mentioned, and I got just two of them.
Oh, high functioning autism, and then just ASD.
Okay, the term high functioning autism is not being used as much in the literature these days. And the reason is that people were thinking that if you had a high IQ, that means you're high functioning autism. And the reality is that the research shows that often the people with high IQ are not high functioning in terms of day-to-day activity. And IQ does not equal high functioning. There are a lot of reasons why people on the spectrum, with high IQs often just do not get the help they need and the support they need early enough to be able to help them deal with what they have to deal with before they begin to give up on trying to deal with these things and interacting with other people.
Several of the attendees have asked about, is Asperger's less diagnosed in women and people of color?
Yes, but that's not the same thing as, is it less present?
Right.
There is a predominance of males in the population of people with Asperger's, but the fact is that there also are many girls and women who have some similar problems, and there's a whole literature on what's called camouflaging, because many of the girls and women work a little bit harder than many of the boys do who have these difficulties to try and cover it up and to try and do what they see other people doing. And sometimes it works, but sometimes it does not. But I would say, probably more males than females. That seems pretty clear. But it is not absent in girls and women. Unfortunately, it's often ignored in them or just not recognized.
Right. Okay, here's a blunt question. Why did the American Psychiatric Association change Asperger's definition, and do you agree with them?
Well, I'll take the last part first. I disagree with the decision. I think it was a mistake.
Right.
And as I mentioned at the beginning, I think there are good reasons why we have a lot of different types of anxiety disorders: separation anxiety, phobias, social anxiety, panic disorder, because each one has its own particular needs and ability to respond to particular treatments. And when you lump all these things together, it doesn't offer, if there are no diagnostic criteria stipulated in DSM-5 for Asperger syndrome, all we've got is the three different levels, which tell us very little about, how to recognize this. So I think that it'd be a good idea to get it back in there. And the diagnostic criteria we had in DSM-4 were not all that bad. It's a good place to begin. However, it's also true that the reason that they, decided, the committee decided they were going to do it all as autism spectrum, is that genetically there are a lot of similarities across these various diagnoses, with the diagnostic subtypes in what now are included in autism spectrum. So it becomes a matter of whether you're a lumper or a splitter.
That's a good explanation. I don't know if you know about this, but what are the differences between nonverbal learning disorder and Asperger syndrome? I'm a pediatrician with a son who's been diagnosed with NVLD, who has ADHD. He fits autism more than NVLD. So,
and probably the autism fits in most cases like that. Nonverbal learning disorder is a category that is not really all that helpful, and it's not widely recognized. You get some psychologists who are likely to do it, but basically it just tells you that their strengths are not, in the verbal domain. But the fact is, if Asperger's fits, then there's probably good reason to find somebody who knows what it looks like and who can help you with that. But the fact that it's coming from a physician also is an example of the fact that there's not much information out there. I taught in a pretty decent medical school on their clinical faculty for more than 20 years. And even there was not that much attention being paid to the education of physicians about ADHD and about Asperger's syndrome.
Several people have talked about this. One mom has mentioned that I have a smart kid who missed the ASD diagnosis just because of her ADHD. They use the ADHD and an eccentric personality to explain away the autism. But she wants to know how, I guess she's 17 now. She wants to know how to get back on track, how to deal with the Asperger syndrome. So
Well,
let's say this diagnosis comes late, which seems like it often does.
it often does come late. That's absolutely true. Excuse me. However, the other thing that may have been at play in this is that years ago, the DSM ruled out the use of an ADHD diagnosis for anybody who is having autism characteristics. That you're just not supposed to make an ADHD diagnosis if somebody's on the autism spectrum. Now, that got corrected when the DSM-5 came out. That was one of the good things they did in that version. But previously in DSM-4, there was reason why clinicians were discouraged from making the diagnosis of autism spectrum and ADHD at the same time.
Mm-hmm.
So we've caught up on that. But I think in losing the ADHD or the option for Asperger syndrome, that created a problem in itself. But what to do about it? You have to ask around, and it's not that easy to find people. The lists I mentioned before in Attitude Magazine and CHAD can provide some help. Autism Now and Autism Parenting Magazine has some resources there. Mm-hmm. But it's important to be able to find other parents who've been struggling with these things and then continue to work with somebody who actually understands it. And, realize that there are a lot of very good doctors and good psychologists and psychiatrists who just have not had much training to deal with these things. Right.
One mom wants to know how to treat extreme anxiety that comes along with the Asperger's. I mean, how should she approach that?
Well, it depends on the nature of the anxiety. Usually I would be inclined to avoid using short-acting benzos, like Xanax or Valium, except for just a particular distance. For example, if a kid freaks out and have to get on an airplane, that short-term use can be useful for that. But for chronic anxiety, which is a very real problem with a lot of people with ADHD, and then an even bigger problem with a lot of people with Asperger syndrome. Usually, one of the first things that we'll generally try is an SSRI, and the ones that have been best tested for use with kids in that category are Prozac and sertraline, fluoxetine and sertraline, the Zoloft and Prozac. But again, dosing is important. And you want to go in with a relatively small dose and then gradually take it up in order to get something that makes a difference. I mentioned guanfacine, the extended release, not the short acting, but the extended release version often can work along with a stimulant. When it's first started, you don't notice much of an improvement. It tends to make people a little sleepy first week or two, particularly if the doses started too high. And the dosing range on guanfacine is narrow. You were usually talking about 1, 2, or 3, max 4 milligrams for a daily dose. But that, along with the stimulant, can help to take the edge off the anxiety.
Are there any therapies that can help with Asperger symptoms beyond the medication?
Well, I think the medication, I always think, change the medication, the body chemistry first, because that's the thing which is most likely to be effective. But there's a kind of, what I alluded to before, is a kind of pedagogical approach or didactic approach that I see my role when I'm dealing with people who have Asperger's syndrome. There's a lot of just sort of teaching them to get them to tell me about the situations that have been frustrating that they've had with family or they've had with teachers or classmates or employers, and then learn about where the trouble is, and then talk with them about different ways they can deal with it. Provide strategies. So in the didactic thing, many people think that psychotherapy always has to be just sort of, digging in and helping people to express their underlying feelings and so forth. And for many kinds of problems, that's helpful. Mm-hmm. But, when you're dealing with somebody who's bumping up against other people in their social interactions frequently, it's often more helpful to be able to see how you can avoid some of these collisions, learning sort of what kinds of things you can say in this sort of situation. Or what, how to ask a question that might be helpful, or when to back off and shut up when people are obviously, having difficulty, continuing whatever you're doing or talking about. Mm-hmm. But I think it's almost like a coaching function. But the trick to it is being able to learn how to think about the way this person is seeing the situation.
Right.
And you have to not only talk to them, but to listen to them. And I'm thinking, for example, about a kid that was complaining that other kids were often beating him up verbally. And that one day, the three kids were walking, across together, and bumped into him in the hall, and knocked all his books and notebooks and everything hit the floor. And what they said as they were leaving was, "You carry too many books, and you think you're so high and muddy." The notion of sometimes people who are very good at answering questions in class have their hand up all the time, and or this particular kid, the thing that had happened the day before they knocked all the books out of his hand was that those three kids were talking with each other about how this test they had just taken was way harder than they thought it was going to be. Uh-huh. And they didn't even know if they had passed it. And the kid's comment to him was, "I don't see what you're complaining about. I didn't study at all for it, and I thought it was easy. I got all the questions." And you can imagine what the impact of that kind of a comment is.
Right.
And as far as he was concerned, there was nothing wrong with it because he was just telling them the truth. And it's that difficulty in sort of understanding how other people are likely to hear it.
Yes.
Rather than, is it true or is it not true?
Right. Well, I think the hour's up, Tom. Thanks so much for being here and sharing your expertise. Very insightful.
I appreciate you setting it up for us, and appreciate the questions people have offered.
Mm-hmm. Great. Hope to have you back.
Thank you.
And thanks to all of the attendees for joining us. Make sure you don't miss future Attitude webinars, ADHD expert articles, or important research updates by signing up to receive our free email newsletters at attitudemag.com/newsletters. Thanks everyone for being here, and have a great day.
For more Attitude podcasts and information on living well with attention deficit, visit attitudemag.com. That's ADDITUDEMAG.com. That's ADDITUDEMAG.com. That's ADDITUDEMAG.com.